of people infected with the coronavirus continues to rise. There are now more than 100,000 cases in at least 95 countries around the globe. In the United States, COVID-19 has spread to every region, including here in New York, where thousands of people are under some form of quarantine. The latest person to test positive is an Uber driver who walked into a hospital in Queens, and now about 40 doctors and nurses are on lockdown. But many people are not being tested. This is one of the most densely populated areas anywhere, and the coronavirus is spreading undetected because there are not enough test kits. Local health officials are pleading for more. But until that happens, New Yorkers could be infected without knowing it.
As New Yorkers, we keep it moving. We keep it moving. Otherwise, to live in panic, that's not the way to go.
Knowing that it's going around, it's just scary, because you don't know if it's going to be you.
It's a problem, for sure, and hopefully it'll get contained.
Before this week, there were no cases in New York. They didn't even have test kits till Monday. And now the numbers are starting to skyrocket. Thousands are in quarantine, many of them linked to one man. A lawyer who worked at this downtown law firm was the first non-travel related case in New York City. His family, his friends, his neighbors, his rabbi have now been diagnosed with coronavirus. His kids' school, the university, the synagogue have all been locked down. An example of just how quickly a virus can spread in a big city like this. And right around the corner, Grand Central Station. Hundreds of thousands use New York's transit system every day. It's a massive travel hub. Subways are now being sprayed down to try to stop the spread. This emergency preparedness expert is advising city officials.
We could be hit by the equivalent of a tsunami that impacts all of the critical infrastructures in the city. And that means not only the healthcare system, but any vital services that are provided to people. That means transportation, that means the food chain supply.
New York City is also the #1 tourist destination in the U.S. Over 60 million people visit every year. JFK is one of the busiest airports in the world. People want to know, why is there not more screening? And airport employees are nervous, but they still need to work. You deal with all these passengers?
A lot of passengers, but I just sanitize my hand and hopefully I'm very scared.
Are you?
Yes.
So what will happen if you get sick?
I don't know.
So is this different than other outbreaks? Back in 1918, the Spanish flu killed tens of thousands here. There were no smartphones back then, not even during SARS. Other big cities and countries like South Korea, for example, are using apps to track people with the virus to let healthy people know what to avoid. And here's the thing, because New York doesn't have enough test kits, they don't even know who to track.
This is becoming an embarrassment for the United States of America. If they could get testing capacity out to cities and towns around America in really substantial numbers, we could actually get ahead of this crisis and manage it properly, because at least we'd know who has it and who doesn't, and we know what to do as a result.
Now I want to bring in Clive Thompson. He writes about science and technology for the New York Times Magazine, for Wired Magazine. You used to live in Canada. Now you've been here for a long time. We're hearing about the Uber driver. We're hearing about the lawyer, that they may have spread it to thousands of other people. What's it like to live here?
Well, it's a little nerve-wracking. People are still mostly trying to pretend life is normal, but they're making a lot of nervous jokes. We're going out to bars, or we're going out to restaurants, but they're wondering what's going to happen if it really starts to blow open.
Well, and you've got the mayor of New York, Bill de Blasio, basically begging for these test kits, and there aren't enough available to find out, just how many people do have it. You're a tech guy. Is this a tech fail?
Absolutely, yeah. It's a serious medical technology failure. And it's a bit surprising when you consider that New York and the US has been through a couple of really big health crises in the past. We had SARS here in New York. They had AIDS. So you would think they'd be forewarned about this, but it seems like they've dropped the ball.
So we're hearing in South Korea, in Singapore, like smartphones weren't around in the old days. They are now, and in these countries, these cities, they're using apps on the phone to track people who are sick, to try and help healthy people stay away from them. Is that, like there's smartphones here, is that something that could be used here?
In one sense, maybe. It's probably a good idea, and New York City has a fair amount of trust with its citizens, but also New Yorkers are a lot more cantankerous and probably less obedient than the relationship that you have in Singapore between the citizens and the government, so I think it would be a harder sell.
But there is technology that can help. Like the people are so reliant on technology today.
Yeah.
Is it a good thing or a bad thing?
Yes, I mean, like there are many good things about it. For example, social distancing, like we're not supposed to be physically around each other. That's a lot easier to do now because you can do video conferencing, you can do texting, you can do a lot more. If you're white collar, you can do a lot more remote work. And that's going to really happen en masse here in New York City.
Well, we're hearing that Amazon, Twitter, some of these big tech companies, a lot of companies are actually saying, hey, stay at home, it'll be all right, work from your computer, work from your phone, don't come into the office. Does that work?
It works if you are a white-collar job where your boss allows you to do that, but there's a huge amount of people, mostly working-class folks in New York City, they have to be physically there. That could be subway workers, that could be waiters, that could be people working in hospitality. It's almost like a feudal economy, right? I mean, the people who are well off will be able to stay at home and sort of, shelter in place. But a lot of those frontline workers, they're going to have to be there and they're going to be exposed. Yeah,
we met a guy at the airport who, he's saying, yeah, I'm terrified. I'm pushing people around in wheelchairs. I'm touching people all the time. Mm-hmm. But I'm from Guyana. I haven't been here very long. Like, I need this job. Not everybody has sick days or sick package.
And you think about all the Uber and Lyft drivers, right? There's a huge number of them in New York City. The city's very reliant on them now. And they're terrified because they're going around constantly being exposed to people.
Well, and this is a city that's very reliant on technology. You've got Uber, you've got Lyft. I guess some people think that if I get quarantined, I'll just stay in my house, I'll watch movies, and I'll get stuff delivered. Does that work?
It's going to be a little tricky because on the one hand, if these gig economy companies shut down, you can't get stuff delivered to your house so easily, and that's going to be a real crimp in people's habits. On the other hand, New York City is dense, so you can walk down the block and get stuff if you have friends and family members who can help out. There's a high level of cooperation, so I think you're right. There's going to be some big disruptions if that gig economy shuts down. I think people will be able to cope, but it remains to be seen.
Well, yeah, until maybe the grocery stores, we'll see how many people end up being quarantined by the end of this. Also, we're on an island.
Yeah.
I guess it's hard if the trucking system gets affected.
That would be massive. I mean, shipping is a huge, huge deal inside New York City. I mean, I live right next to a corner store, bodega, and all day long you can see the trucks showing up delivering stuff, delivering food, delivering beer, whatever. If there's a serious breakdown in transportation, that's where New York City gets really, really hit.
Well, it's quite something. We were out last night in a restaurant. It was fully crowded, no one wearing a mask, so you guys are hanging in.
So far, some of it might be denial, but we're hanging in.
It's been great to talk to you, Clive, and come back to Canada someday.
Absolutely.
Okay, thanks. Clive Thompson, he writes about science and technology for the New York Times Magazine